Thanks, Sanjeet, for that introduction. And yes, otorhinolaryngologist is quite a tongue twister for most people. So to put it very, very simply, I'm your next door ENT surgeon. So ears, nose, and throat is what otorhinolaryngology is all about, right? So I think we're here today to talk about, if I may use the word flavor of the season, which though some more people will obviously not flavor getting this particular infection. So we're talking on Omicron. And before that, I would like to, very briefly talk a little bit about immunity. So let me share my screen. Okay, can you all see my screen? Yes, then am I audible?
Yeah, doctor. Perfect.
Yeah. Right. So since the last 2 years, we've been, literally engulfed by COVID-19, probably starting off from some lab in China and has taken over our lives. And we are still, although we have termed it COVID-19 and it's already 2022 and we're still talking about the same virus. So while we have been going to the hospitals and taking our vaccinations, we have been vacillating between hope and despair. Hopeful that this pandemic will end, and despair because it just keeps on coming back. So my talk today is on Omicron. Is it the beginning of the end, or is it the end of the beginning? Now, I think in the last 2 years, the most frequently searched topic on Google probably would be Omicron, and or rather COVID-19. But we have also been searching how we should be able to prevent this infection. So what we should be doing to get our immunity in place so that we do not catch this or any other infection. So let me start with a little brief on what is immunity. So immunity, if I have to define it, it is the ability of an organism to resist a particular infection or a toxin, something that's invading your system, your body, by the action of these specific antibodies or sensitized white blood cells. So this is a very technical definition. And if I may just put it in lay terminology, immunity is what helps your body fight an invader, whether it is an infection, whether it is a toxin. How your body reacts to that and how your body protects itself is all what we talk about when we are referring to immunity. Now, immunity is a very broad term and it's very difficult to really substantiate or give a number to that. But we need to know that if we need to improve our immunity, we need to know what are we looking at improving. So basically, one is born with some innate immunity. You're born with that. That's the first line of defense. And your skin lining, your respiratory skin lining, your gastrointestinal tract, which has these enzymes, all these play a very, very important role in protecting the body the moment there is an attack from an invader. So that's the first line of defense, which one is born with. The second type of immunity is what you acquire. And that is something that we need to work on. So that's known as an adaptive immunity. That's what you adapt to the surroundings and become stronger. So some of it is an active adaptive immunity, which means that if you get an infection, your body knows all about that infection, and the next time something happens, you're in a better position to fight it. Or it could be artificial, just like how we have been given vaccines, particularly when we are talking about whether it is flu or whether it is measles or whether it is smallpox, it is tuberculosis, or it is COVID-19. So we have been given this artificial dose of the substance that is going to cause you a problem, and that incites an immune response in the body. So it's an artificially acquired immunity. Besides this, you have a passive immunity, and that is what one acquires while you are in the womb. So the natural immunity from the mother. So that's why it's very important when we always tell that, well, you should be breastfeeding the child at least till the age of 9 months to 1 year, because you get a lot of antibodies and passive immunity from the mother. And the last way is an artificial serum where you inject antibodies into the system, and which will be basically to combat any kind of infection. Now, the other term which has suddenly started becoming popular, probably we not heard of it, but now we all talk about herd immunity, and that is something during the COVID-19 infection. So if you have a large number of people, now whether it is 50% or 60% or a little more than that of the population having a particular infection, and developing antibodies to that, you will land up with what is known as a herd immunity. And that is what one is aspiring to move towards in the current Omicron variant infection. So immune system is what is protecting your body from harmful pathogens and all the environmental risks. And a large number of substances in our body and systems in our body are the ones that are playing this role. So whether it is your white blood cells, so when you look at your blood report, you have a hemoglobin and you have a RBC and you have a WBC. So that WBC is what is telling you how well your immune system is working. Then you have various other systems where these white cells, these antibodies are being produced. So whether it is the lymphatic system, whether it's the spleen, whether it's the thymus, whether it's the bone marrow. And all what we do to improve our immunity is directed towards improvement of all these symptoms. But what happens if you have a weak immune system? You're going to get frequent colds, you're going to get frequent infections, you may have digestive problems, your infections may not heal up fast enough, you have delayed growth, you have blood disorders. And if your own body starts fighting against the proteins within yourself, then you land up with these autoimmune diseases. So with this brief background, let us see how and what we can do to strengthen our immune system, because this is the bottom line. This is what we want. So the most important thing one must remember is that immunity is not one structure, one object. Just like you have a balanced diet, when you're eating a meal, you would like to have all the ingredients to it and not just one or two. Similarly, if you have to strengthen your immune system, you need to have all the components in place, and starting off from your diet. So today, if you Google search immunity and immune boosters, then you'll have tons and tons of immune boosting foods and various other things that you will come across. But what is important to note is that a good diet, a healthy diet, is what is very, very important when we are talking in terms of improvement of your immune system. So a diet which is high in fruits, in vegetables, in whole plant foods, in healthy fats, in fermented foods, in probiotics, because that's very important that you have a good probiotic in your system, because this is what is keeping the bad bacteria away and the good bacteria there in your system. So these are the ways and means by which you will have a good wholesome diet, and that will help to improve your immune system. It's also very important that you should be well hydrated. So you should drink your 2.5 to 3 liters of water every day, which is very important for a proper homeostasis of your entire system. So the most important aspect is what you eat and what you drink. Besides that, it is also very important that you exercise regularly. So when we talk about exercise, we are not talking in terms of going every day to the gym and pumping muscles and things like that. It's very important that you exercise regularly. So a 25 to 30 minutes of exercise on a regular basis, 4, 5, 6 times a week, is very important. Because if you tend to over exercise and you only tend to focus on muscle building, you may actually be doing some disservice to yourself, it's more important that you do regular moderate exercise, which can be in the form of a walk or a run or cycling or swimming. Any of these forms of exercises are extremely important in giving you a good and robust immune system. The third and very important thing is to maintain a healthy weight. Because if you are overweight, you will land up with all kinds of diseases. Your immune system is under stress. And that is why it is important that you should be having a proper weight. Overweight people quite often are prone to diabetes, to hypertension, to other metabolic and lipid related illnesses. And all this is finally going to affect your immune system. Stress. Stress can be a major component for your immune system to go down. So you will realize that whenever you are stressed, for whatever be the reason, you tend to fall ill more easily. So it's very important that we manage our stress well. Stress and pressure is always required to move you from point A to point B. But if while you are moving from point A to point B, if it stresses you out so much that you cannot perform, you cannot do the end result, then it's a total loss. So it's very important that we manage our stress very well. And what better way to be able to combat stress is by getting a good sleep. So an adequate sleep, and in today's generation, we find people sleeping for very less and more time spent on social media or at work, etc. That is something that is going to affect your immunity. We heal while we sleep. So this is a very age-old adage, and it holds very, very true. So get your good 6-7 hours of sleep on a daily basis, and that will help keep your immune system in good shape. Also, take all the measures that you can to avoid infection. So washing your hands frequently, and what better way have we learned in the last 2 years that how important hand hygiene is in preventing infection. So that is something. And of course, I need not emphasize more about cooking your meats thoroughly and making sure that the food that you eat is well cleaned and washed before you consume that. A word about alcohol and smoking. So smoking is a strict no from every point of view. Not only I'm talking about the immune system, but it is the cause of so many life-threatening issues besides cancers. And in India, where we have such a lot of consumption of smoke and tobacco, almost 40% of the head, neck cancers are because of people who have been exposed to smoking tobacco in some form or the other. An occasional drink does not do you harm, but yes, in high consumption of alcohol is also something that is going to affect your immune system badly. Now, as I mentioned, that there are so many foods that can help improve your immune system, and consuming a good and healthy diet is very, very important. But I will just emphasize on certain of these supplements which people have been consuming in the last 2 years while trying to improve their immunity and while trying to combat the COVID infection. So you will find that a lot of prescriptions from doctors consisted of quite a few of these vitamins, etc. And I would like to highlight certain things and also debunk some theories as regards all this. So it's important that you supplement wisely to strengthen your immune system. And the first thing that people have been consuming in large quantities has been vitamin C. So you find people taking these tablets of vitamin C of 500 milligrams and 1000 milligrams every day. And according to a review of over 11,000 people, taking 1 to 2 grams of vitamin C per day reduced the duration of colds by 8% in adults and 14% in children. But remember that just supplementing yourself with vitamin C did not prevent the cold to begin with itself. So consuming too much of a vitamin C is not going to help you to prevent any kind of a cold or infection. Our daily requirement is 75 to 90 grams per day. And if you are consuming a good, healthy fruit and vegetable diet, and that probably would contain enough vitamin C to last you for fighting any infection. Vitamin D. Vitamin D today is implicated in a large number of illnesses. And in fact, not only from the point of view of aches and pains, but also a low vitamin D will make you prone to allergies and other infections. So vitamin D deficiency will increase your chances of getting sick. But taking vitamin D when you have already adequate levels is not going to give you those extra benefits. So one of the simplest and easiest ways of getting vitamin D is exposing yourself to sunlight, and that gives you a good vitamin D metabolism. Besides, of course, for milk and eggs and a lot of food items do contain particularly more of the non-vegetarian items. But today you have fortified cereals which can give you enough vitamin D. So that is something that you must fortify your system so as to be able to fight infection. Zinc. Almost all prescriptions in the last 2 years contain zinc in the medical prescriptions. But excess quantity of zinc also is not something that is recommended. So, in fact, so much so that when you all must have heard of mucormycosis, which is the fungal infection that happened post the Delta variant, we were implicating actually excess of zinc to be one of the causes for this whole thing. Then garlic. Now, this is something which has been quite time tested and proven that it improves your immunity. So some consumption of garlic on a daily basis is something that would help not only from your immune point of view, but also strengthening your metabolic as well as your cardiovascular system. So I have highlighted just the various supplements that people have been consuming in the last 2 years or so. But yes, lot of Ayurvedic stuff that is being propagated is good for a large number of people, but one must remember that sometimes you can have a lot of heavy metals in all these, and these can be detrimental to your health in the long run. So whatever you choose to eat as a supplement, eat and consume it wisely. So that was about a general overview of the immune system. And let us go on to, as I mentioned earlier, the current flavor of the season, which is the new entrant, the new virus, the new Omicron variant. So I would like to mention that all RNA viruses, they will mutate over time because they want to survive. And some will mutate more and some will mutate less. Sometimes this mutation is for the worse, where the virus itself gets strengthened, and sometimes it is on the decline where it may not be so harmful for humans. So for example, the flu viruses change every year, and that is the reason why we recommend a flu vaccine every year. And so when you consume that vaccine, when you get yourself inoculated with the vaccine, it lasts the immunity for only a year. So similarly, a new variant hit the world in the last week of November. I would say it got recognized in the last week of November. And unfortunately, it is South Africa which had to bear the brunt, because it's not that this virus was originated, this variant originated from Botswana or South Africa, but it was because of their good genome sequences and the very good genetic typing, they were able to detect this new variant of concern. So you can have variants of interest, which means that they may not be so harmful, but the variants of concern are the ones that we need to be very wary about. And this particular variant was named after the 15th letter of the Greek alphabet. It was actually the turn of the 14th, but the 14th letter is spelled as XI, and the Chinese president wouldn't take it too well. So Z was not the one that we decided to name this new variant, and it was named as Omicron. I was just reading through some literature, and I came across this mention about a Greek god by the name of Omicron, who did not like to see people happy. And probably that's one of the reasons why we've named this variant as Omicron. So it has this 36 unique spike mutations and literally descended from the heavens, and we are here to grapple with Omicron. So this variant is numbered as B11529, and in less than 2 months, so we are almost at 2 months, and it's now found in more than 140 countries across the globe. Last week, when I was asked to cover this particular topic, at that time, the global daily cases were 1.6 million. And over the weekend, now we have more than 2.6 million cases on a daily basis across the globe. So it's probably the most infective virus ever, which has hit this planet. In India, it got recognized again somewhere in the end of November or December, where 2 individuals in Karnataka were detected, one of whom was a doctor, one of the patients being someone who traveled from South Africa. Incidentally, this gentleman within a week moved to Dubai and was untraceable. But how fast is this spreading? So this virus is spreading faster than any other variant, and it is more infectious than any other variant so far. So if we look at what is known as the R factor, which is the transmissibility of a particular virus, so we always considered that the measles virus is something that can spread the fastest and can have an R factor of almost 15. And this particular virus is almost as fast spreading as the measles virus. So there is an increased transmissibility, and its infectiousness from as compared to the dreaded Delta is 3 to 5 times what we saw in as far as Delta was concerned. But fortunately, it is much lesser virulent as compared to Delta. And that is the reason why it has not caused so much of devastation across the globe. But in US, almost 75% of all infections are now Omicron. I would probably say that the number is even more, maybe going towards 90 or 95%, leaving Delta way behind. And it's more than 10 or 12 days ago when US started reporting 10 lakh cases per day. And even today, the last 3 days, they have reported almost 7.5 lakhs on a daily basis. In UK also, the doubling time was every 3 days, and that's how fast this particular virus has been spreading. In India also, I would say till last week when they did some genome sampling, in Delhi, they found almost 84% of the samples to be Omicron. Probably the numbers are again more than 90-95% of Omicron currently, and Delta has taken a backseat. So much so that today we have, for the last 3 days, I think Friday, Saturday, Sunday, and Monday, 4 days, we've had more than 2.5 lakh cases on a daily basis, fresh cases, new cases, every single day across the country. Fortunately, Mumbai and Delhi, from where this started off in a big way, are starting to show numbers that are lesser. So Bombay reported less than 6,000 cases. To some extent, because maybe the peak has already come and is starting to now plateau out or even go down, but maybe also because there are a lot of home testings that people are doing. So also is the case with Delhi. So what are the symptoms of Omicron? Is it like a common cold? Is it to be treated like just a common cold? Because the presentation seems to be almost similar. So most patients presented with fever. A little difference from the previous variants where the fever could go up to almost 102, fever generally lasting 2 to 4 days. When we had the first and the second, in fact, when we had the first variant, the beta, we always found that the fever was not very high. In fact, if it was high, we would think in terms of other viral infections or dengue or malaria or things like that. But yes, in this present variant, fever can go up to 102. A lot of patients complain of sore throat and early morning severe sore throat, which continues for a few days. A lot of patients coming with colds, with cough. The cough can be lasting for many days, and sometimes now we have noticed even up to a couple of weeks. Some patients on the third or the fourth day land up with a severe bout of sneezing, and the next day onwards, the main infection goes away. This is the finding that I have noticed in a few of my patients. Headaches, body aches. So this is something that a lot of patients are complaining, and the body ache and particularly lower backache is something that is lasting for a few days, not just a couple of days, but sometimes a few days. And this infection leaves the patients with a generalized weakness, malaise, fatigue, even for about a week to 10 days. There were a few patients who landed up with vomiting and loose motions. So that is something that we also thought in terms of when we were talking in terms of the Omicron variant. Surprisingly, or I shouldn't say surprisingly, one of the main features of the previous variants was this loss of smell and taste. And with Omicron, there have been hardly any patients who have come forward complaining of loss of smell or taste. So if there is a loss of smell or taste, then we probably suspect that it is a Delta or some other variant. So it has been a milder disease. Generally, people remaining unwell for a period of anything between 2 to 4 days. There are some patients who are completely asymptomatic and just had some mild irritation in the throat or a very mild fever. So most patients had milder disease, but because this started off with the younger patients and now it is moving to the older patients, we should not be taking it lightly, because younger patients with better immunity have been probably able to combat the infection a little better. But now in the last few days, we are hearing of patients who are senior citizens landing up with this infection and landing up with pneumonia and hospitalization. So it should not be taken, kind of brushed aside just as a common cold, but we must be taking our due precautions. So for the record, even the flu virus, which probably would be coming in every year for so many years, would cause 5 lakh cases of mortality across the globe. So same is the case with any variant of COVID. So we need to be careful about the fact that if your immunity is low or if you contract a bad infection, you could land up with hospitalization and ICU. The global case fatality has been much, much lower as compared to even what was with Delta. And that is something that is something to cheer about. So coming to the question, is Omicron milder? Well, it does not affect the lungs so much. It is more above the level of the throat, the pharynx and above. So the chances of getting pneumonia are much, much lesser. But as I said, that if you have other comorbidities, which include blood pressure and diabetes or obesity or any other immune suppressive illnesses, you still can land up with issues. If hospitalization is required, it would be lesser, a shorter hospitalization, more from the point of view of observation. So there is a 45% less likelihood to need an emergency admission. So in the last waves, we had these patients who had what we called as happy hypoxia, where they never realized that their oxygen level is going down and suddenly started feeling breathless and needed emergency admission. So that is something that we are not seeing with this present variant. 70% less likelihood of admission to hospital. So what do we do to diagnose this? So we are all very familiar with the terminology RT-PCR, reverse transcriptase polymerase chain reaction. But today, with the introduction of the rapid antigen testing, also known as the lateral flow test, this is something that we can do at home. Today, you have very good tests, sensitive tests that are available. And this is also something that is being recommended. So the moment you have a cough or a cold or a fever, you can always do this rapid test. Besides the convenience of doing it at home, it is also cheaper and it can give you a fairly accurate result. But if a rapid test is negative, it does not mean that you do not have an infection. So if there is clinical suspicion, then you must go ahead and do an RT-PCR. But a positive rapid antigen test is diagnostic of you having caught the variant. So which means that a false positive is not possible, but yes, false negatives are still possible. So RT-PCR continues to be the gold standard. And that is the test that one must do if you have successive rapid antigens which are negative and you have a strong suspicion that you are carrying the infection. Blood tests. Now, in the last variants, we always did a lot of blood tests. You must be quite familiar with your physician recommending a CBC, a CRP, a D-dimer, trying to look at what your coagulation profile will be, what are your inflammatory markers. But after having done these tests for a large number of patients, we realized that this being a milder infection, all patients were not required to do all these tests. So only if the infection lasts longer or if there is something to suspect more immunocompromised status, then all the blood tests are required. So you should leave it to your physician to decide whether you need to do the CRPs or you need to do the D-dimers. Having said that, in the last wave, we could see CRPs of even 80, 90, 100, and now almost 95, 97% of the patients who were tested, the CRPs were almost within normal range, less than 5, just a few coming in the higher teens, and very, very rarely in the higher numbers. Similarly, a CT scan of the chest was something that the moment people were coughing during the last wave, they would rush to get a CT scan done and look at your CT value of that and see whether your chest is getting infected and pneumonia. So this is again something that we are not recommending at all, patients going for CT scans for this particular viral infection. Also, I must highlight the fact that whenever you get your RT-PCR done, there is a cycle threshold value, the CT value, which is looked at very, very closely by every individual and lay person. And it is not something that we pay too much of attention to. So it does not mean that if your CT value is low, which means if it is 13, 14, 15, you are definitely going to get some very, very strong infection. So please do not get stressed when you look at the CT value and start imagining that if it's low, you're going to land up into hospital. What is the treatment? The treatment, it being a milder viral infection, is going to be symptomatic treatment. So symptomatic treatment in the form of what are our symptoms? Fever. So kindly take a paracetamol, whether you take 500 milligrams or 650 milligrams twice or thrice a day, depending upon your body weight, to bring the fever down. Fever is actually your body's defense mechanism. So if it is only 99 or 99.5, please do not need to take a paracetamol. If it's higher than that, then only should the paracetamol be prescribed. Compound cold medications to take care of your running nose, of your sneezing, your congestion, cough syrups for the cough, vitamins. So extra vitamins is not really required, but yes, you can take your daily general vitamins which you are taking. Antiseptic gargles using povidone iodine, because the center being the back of the throat, you can do these gargles to help eliminate the bacterial or viral load which is in the back of your throat. So just general treatment as far as infection is concerned. Now, coming to the very popular antibody cocktail, which had become almost a household name, particularly during the Delta variant. This is something which got popularized when President Donald Trump, while he was campaigning, took the cocktail and was back on his feet in 2 or 3 days. Well, the monoclonal antibody cocktail was for the Delta variant, and it is certainly not for this particular variant. So it's a not only a waste of time, energy. So please do not pressurize your physicians to give you the cocktail. Only if there is some very pressing reason, and if we feel that it's not the regular variant, would the physician decide to go for the cocktail. So there is currently one cocktail which is available only abroad, not over here, which has been given FDA permission, but let's not even talk about that since it's not available. What about the antivirals? So remdesivir became a household name in the last two waves. And this is again something that is not really required for a majority of our patients. Unless there is some pressing reason, if there is severe comorbidity, or if there is some reason your physician will decide, then the antiviral remdesivir may be recommended, particularly in the initial stages of the infection. The other drug that started becoming very popular and was splashed across all the newspapers and media was molnupiravir. And this was being prescribed left, right, and center. And now a lot of us physicians and doctors have written to the government that this is not to be used on a regular basis. There are strict reasons and indications where molnupiravir may be recommended because of the side effects that it can have. So it's something where it can induce changes in the fetus. So there is a teratogenicity, and that's why not recommended in the childbearing age if you have a female, pregnant female, or wanting to get pregnant and planning a child. We do not recommend that at all. Even there are some reports of it affecting the cartilage metabolism. So that's why even for children, it is not being recommended. The drug Paxlovid is something that, again, if required, your physician will recommend. So once again, to reiterate that blood tests and CT scans are not required unless they are recommended by your physician. So we should not be complacent about this infection. It can transmit much faster. So far more number of people can get infected by this. And when we talk about far more number, we know the numbers that are getting affected. As I mentioned earlier, that 10 lakhs per day in a country like US and India with its huge population, if we have even a very small percentage of a large number getting serious, then that number can be very, very significant. Also, we need to remember that a large number of the healthcare workers got infected, particularly in Bombay and Delhi in the first 10 days of the month of January. And if that happens, then the whole system, I mean, if you flood the hospitals and if there aren't enough healthcare workers to look after, it could lead to a quite a catastrophic situation. We have no idea whether this particular variant is going to give the long COVID symptoms. It's too early to comment on that, but because it is a milder variant, chances of it causing long COVID symptoms would probably be much lesser. But yes, younger population is non-vaccinated, so the chances of spread being fairly high. And of course, the impact on school and work and on society in general if you fall unwell and you are not able to go to work. What about the vaccine? So the vaccine, unfortunately, the ones that we have been taking, our first and second, and now even the precautionary or the booster dose, has not been very effective against Omicron. So according to the data, if you've taken just 2 doses of the vaccine with the Pfizer one, it could give you protection in a immunocompetent patient only up to 20%. And with the AstraZeneca, not even that. But yes, once you take the 3rd dose, then your chances of immune escape is much lesser. So the 3rd dose would help to that extent. Although in the times to come, I'm quite certain that the newer vaccines will be able to cover this variant as well. But what the vaccine ensures is that it can help retain its efficiency against severe infection, against hospitalization, against the need for requirement of oxygen, and of course, death. In fact, lots of deaths have been prevented because of the vaccination that took place. A lot of places we had patients who still went to hospital, but a lot of patients in the Western countries where immunization did not take place as well as in our country have landed up with hospital and with severe problems. A word about Omicron in children, because that is the population that is getting more and more exposed because of the transmissibility. So almost 1 in 10 American children did test positive for the virus. But again, the symptoms have been similar. Mild fever or maybe going up to 101, 102, a sore throat, cough, running nose. Treatment continues to be the same. Home isolation, paracetamol for the fever, gargles. Make sure that your smaller, younger children are well hydrated and a good nutrition. What are the red flags in case of smaller children? If they have difficulty in breathing, if there is a case of blue lips or the face turning blue, if there is chest pain, if they're just not able to take food or drink, or if they are in a state of confusion and not interacting well when awake, these are the red flags, and these are the times when you may need to think about hospitalization for children as well. So friends, what should one do to protect oneself and others from Omicron? Well, once you are aware of all the symptoms of Omicron, if you have any of this, recognize that, get tested at home itself if you do not vote for the RT-PCR. But the moment you know that you are carrying, or if there is a severe suspicion of carrying of the infection, isolate yourself. So that will help prevent you from spreading the infection to your near and dear ones. If you live in an area where there is a high rate of infection, consider just staying home for those few days and reducing your social contact. Make sure that you get fully vaccinated. The moment you are eligible to go for your third shot, please go ahead and take your vaccine. If you have to travel, if you have to go to any crowded area, a single mask may not suffice. So please wear either an N95 or a double masking is what is being recommended. And of course, try to improve your immune system and your health with the changes in diet and lifestyle that we earlier talked about. So I cannot but reiterate the importance of masking, the importance of social distancing, the importance of hygiene, whether it is hand hygiene, whether it is cough hygiene, hygiene in general, and the importance of vaccination. A few seconds on the masks. So the N95 is what filters out 95% of the tiny 0.3 micron micrometer particles. You also have the Chinese version, which is known as the KN95. So the least protective mask is the surgical or the cloth mask, if worn alone. The next is, of course, a combination of the cloth mask with the surgical mask. But if you are going to an area which is crowded, I would recommend that you wear the N95. I would also like to highlight this particular slide, which highlights the fact that how masking can protect you and from getting an infection. So if you have a person who's infected and is not wearing a mask, and you who are not infected are also not wearing a mask, then within 10 to 15 minutes or even shorter duration of time, you can get infected. If the person who's infected is wearing a cloth mask and you also are wearing a cloth mask, then the chance of your getting infected still could be within 20 minutes. But if you're wearing a surgical mask and both parties are wearing surgical masks, then the chances of getting infected is an exposure of even 5 hours it could take. Whereas if you're wearing an N95, particularly a person who is infected, then even if you are exposed and you're not wearing anything, the chances of catching an infection is as high as 2.5 hours. But yes, If both of you are wearing an N95, then it could be 25 hours before you can get infected from a patient carrying an infection. So that is what signifies and highlights the importance of the mask. So the mask is like your seat belt. A seat belt will not prevent you from getting an accident, but if there is an accident, you are better prepared. So same is with the vaccine. So that is the role of the vaccine. I leave you with these words. Now, this is not the end. It is not even the beginning, but perhaps it is the beginning of the end. So let's look at this as that there is light at the end of the tunnel. So what if the tunnel is a little longer than what we had imagined when we set out in the early 2020? But yes, history has taught us that the third wave of any infection, any pandemic is generally indicating that yes, and particularly when we have a milder variant, that this may be the end of the pandemic. So with this, I finish my talk and I throw open the house to questions.
Yeah, thanks a lot, Doctor. For Q&A, I think what we can do, for maybe participants can raise their hand and we can bring them on stage and we can do a live Q&A.
Yes.
So I would request folks to maybe raise their hands via Zoom so we can bring them on. Or maybe they can type on, maybe you can type on chat and
type it, yeah.
I've already got two cues, Doctor. Maybe we can start with them.
Yeah, so I see, is consumption of garlic as part of cooked food sufficient? Yes, so the amount of garlic that we consume to taste is generally sufficient as far as whatever role it plays in your immune system. So that is something that is generally in sufficient quantities. Yes. How soon someone can get the Omicron reinfection after recovery? So, well, this is something that we still need to study. So, in the last variant, when we had Delta, we did come across patients who got a second infection with Delta. So, which means that the immunity may not last you for a very, very, very long period of time. So also with Omicron. So I have a couple of patients who in the last week of December had fairly good antibody levels with the previous infection. So they had Delta in the month of August or September. And lo and behold, in the first week of January, they came down with the Omicron variant. So as far as getting a reinfection with Omicron, I cannot rule it out, but the chances are very less, minuscule. But only time will tell us whether how soon can we get it with Omicron. While taking Dolo, so Dolo has become a generic a household name. So it is basically, Dolo is paracetamol 650 milligrams. I think Hetero Micro Labs is the maker of this molecule, and it's laughing all the way to the bank. Twice a day, will it help to take Omicron? So Dolo is paracetamol. Paracetamol is what you will take if you have fever. So taking paracetamol is not going to combat the Omicron virus. It is meant to combat the fever that comes along with the Omicron virus. So you take Dolo, you take any paracetamol whenever the fever is of a little higher grade. As I mentioned, that taking paracetamol for a 99 fever is really not warranted. It's your body's defense mechanism. It's trying to fight, so it's fine. But yeah, if it is more than 99.5, that's where you should be taking the paracetamol. And of course, if the fever goes to a 101 or 102, then the tepid sponging, which we would do when there is high-grade fever, you can also, if the fever is not coming down with paracetamol, then opt for another molecule called mefenamic acid, which also brings down the fever quite well.